Hello, my name is Alex Singh-Guerra, and this project is for NSG 348, Final Virtual Poster. The purpose of this paper is to reduce the omission of pertinent patient information during handoff report between behavioral health nurses in the hospital setting. Nursing is a very fast-paced and ever-changing profession. That's why it is important to have a tool such as the SBAR sheets, which allows professionals to expedite patients quicker and with less complications. SBAR sheets can be used to target pertinent patient information, pass this information along to report, and address patient needs in an organized and effective manner. Bowers and Garrett, 2016, elaborate that the use of the SBAR has many benefits, such as reducing patient harm and mortality. McKeek and Bueno have elaborated on the fact that the Joint Commission has outlined key elements to effectively communicate between healthcare professionals. Some of those key elements is having a standardized hardwire system, as described by McKeek and Bueno, 2016. Some of those standardized hardwired systems may include the use of the SBAR sheets. Novak and Fairchild, 2012, describes that the Joint Commission has talked about lapses in communication as one of the major causes of patient harm and has added effective communication as a set of national patient safety goals for the last 9 years. The second national safety goal addresses the need for healthcare professionals to improve communication during handoff report to protect the patients from harm. As a result, 2/3 of adverse events in hospitals are related to communication issues. Whittingham and Aldroy, 2014, also estimate that 1 in 10 patients are harmed during hospital stays due to lapses in communication and not having an organized, structured system such as the SBAR tool. The clinical question is as follows. Do behavioral health nurses that use SBAR sheets versus behavioral health nurses that do not use SBAR sheets during handoff report have a reduction in the omission of pertinent patient information? Evidence-based search process was consisted of using the Translational Research into Practice TRIP database. The keywords that I used were SBAR and communication. What I included into my search process and the limitations were primary research and articles that were published by 2012. I initially got articles, 18 in total, from the TRIP database. What I used to exclude these articles were to make sure that they were appropriately used and that they had a level of evidence that was a level 1, 2, or 3. After that, I got 9 articles that were identified and I used 1 article. The second database that I used was PubMed. The specific words that I used was SBAR and communication. The criteria that I included was that the articles were published within 5 years and humans. The initial articles that I got were a total of 51. The exclusion criteria that I used to make sure that the articles were appropriate is that they were at a level 1, 2, or 3. After that, I got a total of 16 articles that were identified and 2 articles were used. The study from Kang and Yu 2017 shows that when an organized and structural tool such as the Situation Background Assessment and Recommendation SBAR tool is used, communication clarity, confidence, and satisfaction increase. This study was a quasi-experimental study in which they used a simulation, pre- and post-test for the intervention and control groups. The end result was that the intervention group displayed a higher situation, background, assessment, recommendation, and communication scores. The study conducted by Fabila et al. 2016 shows that a communication tool such as the SBAR tool greatly increases teamwork and collaboration between members of the healthcare team. When structured communication tools are used, such as the SBAR tool, patient outcomes, safety, and satisfaction increase. The study from Fabila et al. 2016 was a controlled trial design. The results of the study showed that nurses indicated that information transferred during face-to-face verbal handover was frequently sufficient and after implementation of the SBAR compared to the pre-implementation phase. 95.5% post-intervention versus 31.8% pre-intervention. A study conducted by Fleming and Hubner 2013 shows that after evaluating 93 studies, multiple studies show that the use of the standardized and organized tools such as the SBAR can facilitate the transfer of pertinent patient information during the communication process between healthcare team members. Fleming and Hubner 2003 also show that the lack of a standardized process or tool and lack of preparation during the handover process
as the main reason for omission errors during change of shift. In all 23 studies, clinicians felt that they communicated better, observed a decreased amount of omitted information, and observed decreases in patient adverse effects because of the SBAR tool.
As stated by Fabile et al., all institutions should implement the use of the SBAR tool into all units in the healthcare setting due to its proven track of reducing adverse effects and increasing patient outcomes. There is no need for IRB involvement in my research project due to having sufficient evidence from level 1, level 2, and level 3 articles. In order to implement the change initiative, I will involve and ask permission from the appropriate hierarchy staff to initiate change on the behavioral health units. I will then target the appropriate staff, attract their attention to the change initiative by using education. I will use the help of the risk manager for statistical data. Staff meetings and PowerPoint presentations will also be used. How will I evaluate the change? The nurse educator and I may develop an electronic SBAR tool into a patient's chart to keep track of staff compliance. Nurse staff surveys will also be provided. As indicated by Clark and Marks Moran 2014, it is important to have the support and guidance of appropriate hierarchy staff. Education is key in sustainability, according to Vela Page, Edwards, and Wand 2014. Staff meetings and daily huddles are also very important for sustainability, according to Vela Page, Edwards, and Wand 2014. And finally, by Willis et al. 2016, policy change makes a big impact in the sustainability of a change initiative.
It is also necessary and very important to have face-to-face teaching sessions, group discussions, and model principles should also be discussed in these meetings. Training manuals, a culture of education, and reasoning should also be fostered on the behavioral health units. Willis et al. 2016 also discusses that policies and procedures of an organization may help with a change initiative by making it the new norm, which values in organizations and institutions, mission, and vision.